بسم الله الرحمن الرحيم إن الحمد لله والصلاة والسلام على رسول الله. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallahu khair, everyone, for joining us live today on 10th of May on a Sunday in the holy month of Ramadan. You're all joining in for our webinar, the free webinar from Balagh Academy. Basically, this is a webinar which will be discussing the fiqh of medicine related to fasting. Some of you are our students. You know Balagh Academy really well. Some of you are joining us for the first time. So assalamu alaikum, especially for those of you who are joining us for the first time. The aim of this webinar is the aim is basically to shed some light on the dynamism of Islamic medical fiqh in the light of scientific and Islamic perspective. We'll also be discussing up-to-date knowledge and fasting whilst addressing the differences of opinion. We'll also explore essentially contemporary issues relating to fasting and medical advancements, such as patients with diabetes, cancer, terminal illness, mental health issues, and specifically speaking, COVID-19, which is, of course, a major issue at the moment. Also, we'll be discussing the exemptions, if any, that apply to this particular category. And later on, as we progress, we will hopefully be joined in with our colleagues. There'll be a panel discussion. So we'll start off with Sheikh Dr. Rafaqat. He'll be doing his presentation for the first 45 minutes or so, followed by a Q&A. Then we'll have Dr. 𝐁𝐚𝐥𝐚𝐿, and then in the end, we will have a panel discussion in which we'll be joined also by Dr. Bilal Patel. For those of you who don't know Sheikh Dr. Rafaqat Rashid, he's a Muslim scholar. He's a GP based in Bradford. He's a professional trainer educator. He's a co-founder of Balagh Academy and a course director of its courses and medical the fiqh program, which is quite popular. He's also a lecturer at the 𝐁𝐚𝐥𝐚𝐿 Institute, and he's an academic in the field of Islamic medical ethics and medical law, having obtained his master's from University of Manchester on the subject of Muslim scholarly debates on the issue of organ transplantation. He also holds the title of honorary lecturer at the University of Leeds. His introduction, mashallah, keeps going on and on and on, so I don't want to bore you with that. He doesn't really need an introduction. So I'll hand over to Sheikh Dr. Rafaqat now. Assalamu alaikum wa rahmatullah.
Wa alaikum salam wa rahmatullahi wa barakatuh. Alhamdulillah wa kafa wa salatu ala ibadihi allazina istafa. Assalamu alaikum wa rahmatullahi wa barakatuh. Now, what I'm going to do is, I've got approximately 1 hour. So inshallah, in this 1 hour, what I would like to do is talk about a number of different issues related to the fiqh of fasting, more specifically in relation to medicine, medical interventions, and medical care. Now, so what I'm going to do is I'm going to emphasize or work along 2 particular parameters. One is safe fasting, and the other is about invalidators of fasting. So these are 2 of the most sort of common questions that are normally asked regarding fasting during the month of Ramadan. So I'm usually inundated on my mobile phone by either ulama or medical professionals or just general public, asking a number of different questions on some of these quite important issues. Now, before I actually go into the detail of these issues, I just want to emphasize 1 or 2 points that are quite important, and that is that I'm not here to just lecture, so please make this as interactive as possible. I've told Dr. Arshad that if you need to intervene during the presentation, I'm more than happy to address your questions. Sometimes things turn up into our minds that we want to inquire about, and as the presentation goes on, if you don't catch them at that moment, we lose them. So for that reason, I'm quite happy to address any questions that are important and specific and related to what I'm talking about at that particular time. So inshallah, we're going to talk a bit about safe fasting. Okay, so that's a fundamental sort of objective of today's session. And then inshallah what we'll do is I'm going to go through the theory and the principled approach that ulama use when they talk about the issues of what invalidates fasts. So hopefully within about an hour, I'll try to address as much as I can. But like I said, I'm not too concerned because these sessions have been delivered before You can catch my recordings on YouTube in relation to some of these issues. So I'm willing to go into as much detail as you want me to go into, inshallah. Okay, so let's talk first about safe fasting, and we're going to address the issue regarding Muslim patients and also health professionals as well. So there's an issue about safe fasting with health professionals, especially during the time, the current sort of climate that we're in regarding COVID-19. Okay, so let's just talk a bit about Muslim patients and health professionals. We'll spend about half an hour or so just talking about this, and then we'll talk a bit about the other end, which is about the invalidators of fasting. So here we have some verses of the Quran that we relate to. يَا أَيُّهَا الَّذِينَ آمَنُوا كُتِبَ عَلَيْكُمُ الصِّيَامُ كَمَا كُتِبَ عَلَى الَّذِينَ مِنْ قَبْلِكُمْ لَعَلَّكُمْ تَتَّقُونَ. And then Allah subhanahu wa ta'ala says أَيَّامًا مَعْدُودَاتٍ, and then these are additional days. فَمَنْ كَانَ مِنْكُمْ مَرِيضًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرَ وَعَلَى الَّذِينَ يُطِيقُونَهُ فِدْيَةٌ طَعَامُ مِسْكِينٍ. So here Allah subhanahu wa ta'ala clearly outlines in the Quran, number one, the obligation of fasting. So fasting is no simple feat. It's a very important thing, and I'm just going to elaborate on that later on in terms of the importance of fasting. And secondly, here very clear indication within the verses of the Quran that Allah subhanahu wa ta'ala has clearly outlined that there are certain exceptions to those who are either ill, who are on a journey, or clearly are traveling, and who are undergoing an element of hardship. So on those basis, I will elaborate and discuss some of the important things related to this. There are other verses, there are many ahadith that also refer to this. So I don't need to go into the detail of that, but just emphasize that these are things that clearly Islam recognizes, is clearly sarih in the nas, is clear in the nas, in the Quran and Sunnah, and these are things that clearly you will find the ulama usually address when they're dealing with these issues with general people, general public. So just before I go into the details of this, you also need to recognize that the maqasid of the Sharia, the purpose of the Sharia, are mainly two. Okay, there are additional components to this, but when I talk about two themes that usually align related to how we should enact the Sharia into our lives. Okay, so one is in relation to what we call the exoteric acts. So these are external acts that we do or we perform, and these are called a'mal zahiri, and these are sort of the acts that are openly done, that we perform. So these are usually attached to legal sort of frameworks or normative frameworks within Islam. So for example, fiqh will address the issue of our exoteric acts. So even though this presentation is labeled as the fiqh of medicine, and we're focusing more on the legal sort of aspect of, or the normative aspect of fasting, we cannot go without understanding the esoteric acts, which are the amal batini. And as the Quran has already stipulated, كُتِبَ عَلَيْكُمُ الصِّيَامُ كَمَا كُتِبَ عَلَى الَّذِينَ مِنْ قَبْلِكُمْ لَعَلَّكُمْ تَتَّقُونَ. So Islam has clearly addressed the issue that the obligation of fasting is not just to abstain from food and drink, but it's to gain taqwa. And amal batini is addressed through the whole idea of tazkiyah al-nafs, about building ourselves, our character, our personality, making ourselves obedient to Allah subhanahu wa ta'ala, having the element of raja, of hope in Allah subhanahu wa ta'ala, and also the element of taqwa and fear of Allah subhanahu wa ta'ala. So, or the khawf of Allah. So here you can see that there is a very much more sort of larger framework in terms of what we address when we talk about the issue of fasting. But today, inshallah, we'll be focusing more on the exoteric acts more fundamentally. But before I do that, I'm just going to emphasize one little point about the esoteric acts. So I will make reference to Imam Ghazali's Ihya Ulumuddin. In there, he talks about some really interesting things. He talks about, in essence, he classifies people into three sort of groups, three main groups. So he talks about the first kind of group, who are the ordinary people, the ordinary Muslims who fast. So these are, he says that these are the Sawm al-Ma'soom. These are the fasts of those people who are, in essence, just doing this on an ordinary level. And what they tend to do is you abstain from food, you abstain from drink, and you abstain from sexual intercourse, because these are clearly prescribed in the Quran. And that's about it. You know, that you fulfill those commands Okay, fair enough, you read your salah and you give your zakah maybe, and you fulfill those commands, and this is very virtuous in itself. I mean, there's an immense reward for you just to be falling within this ordinary category, regardless of even going into any other higher category. So just on this particular category, there is a immense reward. The second category is what we say is the Sawm al-Khusus. So this is the select few. So these are people who go beyond this. So refraining is not just about physical acts, okay, but rather it's about more internal acts. So it's about unlawful gaze, a non-mahram, unlawful speech, no ghiba, no backbiting, no kadhib, no lying, and things like that. So other unlawful acts, not listening to things such as music of an evil nature, tale-bearing, unlawful use of limbs, committing haram acts with your hands, and overindulging in food. Interestingly, Imam Ghazali also includes this because this is about controlling one's passion. So these are for the select few. These are Sawm al-Khusus. Then he goes on beyond that, and there's another group of people who are very close to Allah subhanahu wa ta'ala, and he describes them as Sawm al-Khusus al-Khusus. These are like the elite amongst the mu'mineen. And these are individuals who refrain from that which leads to all above. And in addition to that, they also refer to those individuals who refrain from worldly matters as well. So they abstain from the dunya. So in essence, when you go into i'tikaf, for example, then that is a period where you abstain from worldly things. So there is no work, there is no sort of worldly speech or discussions about worldly sort of duties that we have. And it's solely about Allah subhanahu wa ta'ala and his faith. And these are like the elite group. So having emphasized this and recognize that these are things that we should aim to achieve during Ramadan, I will now go on to the discussion regarding fasting, who it's obligatory upon, who it's not obligatory upon. Now, these have been probably discussed by other speakers prior to me, so I'm not going to go into the details of this, but just briefly outline the different groups of people who are clearly exempt from fasting. So one is somebody who has not achieved Balagh, i.e. maturity. So usually addressed around about the age of 12 years. So under the age of 12 years, you'll find that even then children tend to fast. And if they're able to, then alhamdulillah, that's a good training regime for them to, and children usually, because they're in the spirit of fasting, they have other people who are fasting around them, they're quite keen to fast. My daughter's quite young, but yeah, she'll be very keen to fast, and the reason why she's keen to fast is because all her siblings are fasting at the same time, and she'll insist. So even if you were to encourage her not to, she'll still be abstaining from food and drink because it's that zeal for fasting is there. So the other is a group of people we're going to be talking more about are the persons incapable of fasting due to physical weakness, they're acutely unwell, terminal illness, that's another reason, chronic diseases such as diabetes or bronchitis, mental illness or learning impaired individuals. So these are another group of individuals who are also exempt from fasting. We'll talk a bit about that in more detail with my presentation, also in more elaborate on that in more detail later on. Then there's a group of people who are, women who are pregnant or breastfeeding mothers. So these are, in essence, if there's a risk of harm to themselves and harm to their child, unborn child, then on that basis, they are also exempt. And then there's issues of tahara. So we have issues of ritual purity. So menstruating women and women who have postpartum nifas, bleeding, they are also not supposed to be fasting in that particular state. And finally, we have those who are musafir, those who are actually traveling. So individuals who are traveling, then they have the option to fast or not to fast. Well, hopefully, inshallah, that will address the issue about who fasting is obligated upon and who it's not obligated upon. And then now moving on to the issue of atonement and expiation. Now, I'm not going to elaborate on this in too much detail, but the reality of this is that if you miss your fast for whatever reason, for concession reasons or no concession reasons, then you must make up for that fast. And because it's fard, it's an obligatory act, and the whole purpose of the obligation is for you to gain a spiritual height. So for that reason, then you will be expected to make up for this if you are not achieving it during Ramadan. So you have to make up for a missed day, as soon as possible after Ramadan. If you are unwell and you have a chronic disease, or you're not able to fast throughout the remaining end of your life, and then on that basis, then you would give what we call fidya. So this is like an atonement. It's a small amount of money that you give for every day that you miss your fast. And this is in essence only applies to Ramadan in this sense. So if somebody's, for example, chronic severely ill or has frailty, then they would be exempt. Then the last is kafara, expiation, and this is according to some of the schools of thought, so the Hanafi, the Maliki more so rather than the Shafi and the Hanbali, but generally speaking, then you give kafara. Kafara is a form of expiation, and in a kind of a way, what it is it's a deterrent to prevent those people who are sort of deliberately and willfully, not fasting in this very important month. So if you were to eat or drink through an act which clearly is what we say suratan as-sawm, so siyam suratan, so that it's basically somebody who is eating and drinking during the month of Ramadan, fully knowing well that he is fasting, i.e. there is no sort of issue of the fact that he's forgotten or she's forgotten to fast, but they're clearly doing that, then in that instance, then they would have to pay by expiation, and that is kafara. Kafara is you must fast for 60 consecutive fasts, or feed the poor 2 meals for 60 days. But initially, you must try to achieve the 60 consecutive fasts through any time after Ramadan. Okay, so hopefully that's addressed the issue regarding the atonement and expiation. Now, I'm just going to talk a bit about some principles about safe fasting advice for patients. Now, before I do that, I want you to think about these 5 particular cases, okay? And we will address each one of these 5 particular cases. So, I can see probably majority of you are probably medical professionals. We've probably got some ulama as well, and we've got a mixture of some other general public. So these are kind of questions that come frequently. The first question is a patient who's suffering from asthma and hay fever. Should that person fast? What would give you some kind of indication that at this stage that person should be fasting now or not fasting? Then there's something around frail elderly people who are quite weak, or they may have some element of dementia, and they may have some confusional states. When do we exempt them from fasting? When do we decide that they are also exempt from this particular act? Then we have the young who may have severe pain. So it may be back pain, it could be pain elsewhere. Do they have exemptions in this particular instance? How do we address that issue? So somebody's clearly got a lot of pain. They're not taking regular pain relief because they are fasting, and for that reason their pain is quite exacerbated. How do those individuals deal with this issue? Then we have terminal patients, so cancer patients maybe. How terminal are they? To what degree are they unwell at this particular stage in their journey? So these are kind of things that also need addressing. And then finally, a diabetic patient on insulin. So when do we decide that a person who's on insulin and they're diabetic, they are also exempt from fasting? So these are quite a number of different questions that in essence we deal with on a day-to-day basis during this merciful month. The question arises, what kind of rubric have you got in your mind? How do you make decisions related to this? Do you just turn and say, you must ask your doctor and just leave it to them? Do you actually make some of these decisions yourself? And these are quite important sort of kind of questions. Dr. Rashid, if there's any questions anybody has, I'm quite happy to address them.
Sure. We haven't had any specific question regarding the topic that you're discussing at the moment. There are a few that will be addressed later. Okay,
inshallah, no problem. Okay, so the question arises here. Well, those are things to think about. Okay, and now I'm going to address the issue. Now, the first thing is about judging unfitness to fast. Now, from the fiqh literature, the ulama have addressed this from a number of different perspectives. They talk about the issue of where there's ziyada, there is addition or there are exacerbation of symptoms. So if a person clearly experiences whilst fasting, so this is in the state of fasting, you're in the state of fasting at the moment, and you notice your symptoms exacerbating. So let's say, for example, you're somebody who's asthmatic. So let's go back to these individuals. Okay, so somebody's asthmatic. their symptoms have exacerbated during the day. They're becoming a lot more wheezier, they're getting more short of breath, and they feel that they need an inhaler. Okay, now there is a difference of opinion regarding inhalers, but let's take the idea that the inhalers do invalidate the fast. So on that basis, they will take that inhaler, and clearly that will break their fast. Now, on that basis, what will end up happening is this individual, ideally in that situation, what they've done is they've judged this idea of them being unfit to fast on the basis of their exacerbated symptoms. So the Sharia allows for that, and it talks about that in terms of the fiqh literature, that individuals who have exacerbated symptoms, then they are exempt from that fasting. Now, the thing that it talks about is the idea of what we call a dhannu ghalib, or predominant probability of harm. In other words, that there is a predominant understanding from either advice from healthcare professionals or through personal experience, that if they were to fast, then their symptoms would exacerbate and it would cause quite considerable harm for them. Now, we'll talk a bit about the issues of harm in a short while. So then the other thing is about what we say is you go to what we call tabib al-hadiq, fahul mastur, somebody who is pious, upright. These are kind of people that you should approach and get their advice. Now, clearly, if you're living in a society where there are not many Muslim doctors who are not always upright, so there's a condition. Number one, they must be Muslim. Number two, they must be doctors who have got clear expertise in this area. And number three, they must be upright character. They have an upright character, and they ideally pious individuals. And unfortunately, that's not very common. And we do find Muslims who are quite the contrary. We find doctors who don't always have the right level of experience in this area, but they will advise. So you have, for example, a surgeon who's advising somebody who's got, chronic bronchitis, for example. So it has to be somebody who's got a good interest in that particular area as well. Now, because of the climate that we're in, the main thing is that as a general piece of advice, any kind of health professional who has clearly an understanding and experience in that particular area, then they could be approached. It doesn't have to have the condition of being a Muslim, as long as he is sensitive to the needs of a Muslim. Ideally, if he is a Muslim and he is somebody who's upright, or she is somebody who's upright in terms of their conduct and behavior, then that would be an ideal situation. But the world is not ideal. So for that reason, even approaching somebody who is a clinician, who's got an expertise in that area, and they are quite sensitive and quite open to the idea of Muslims fasting, and they give sound advice on that basis, then those kind of individuals can also be approached. Again, and it has to be what we call a dhannu ghalib. It has to be predominant probability of harm, and from that point they can then say that you should abstain from fasting. The third is personal experience. So this is about your own personal experience. You've realized that usually when you're feeling the way you are feeling, that if you start fasting, your symptoms will exacerbate. I had somebody very recently, just in fact a day or two ago, who was telling me that his wife's got severe migraine, and she knows that when she starts fasting, her migraine exacerbates quite considerably, and she's in bed all day, she starts vomiting and so forth. So clearly she's got experience that when she gets a migraine attack, this is what happens, and she knows, she can sort of has a foresight in terms of what's going to happen during the day if she does fast. So she would be considered as somebody who's exempt on the basis of her personal experience. So there's three things. Whilst you are in the state of fasting, if your symptoms exacerbate, then you can be exempt from fasting. Whilst you are in a state where you can ask advice of somebody whether you should be fasting, and this is even before you are fasting, i.e. don't make an intention for fasting during that day. And also through personal experience, if you know that you are unwell, or you know that you're in a certain circumstance that your symptoms would exacerbate to a certain degree, and there's a predominant probability of that happening, then on that basis you can also exempt yourself from fasting.
Sheikh Rafaqat,
Yeah.
just pick your brains on this. We had a couple of questions regarding the two concepts that you mentioned there, Dhannu ghalib and of course an upright physician. This is something I personally have come across a number of times as well, as to the predominant probability of harm.
Yeah.
That's very, very subjective from physician to physician, and add that, the requirement of having an upright physician, you're going in a very, very murky zone. I mean, you can't really differentiate. Is this advice coming because the physician is just skeptical or is fearful of a potential harm? Because the term that you used here is predominant probability of harm. Can you elaborate that slightly? Because there have been a couple of questions on that.
Okay. Yeah, you'll find that ulama usually tend to shy away from actually making this very specific in terms of what exactly that actually means. So I did quite a bit of work on this and try to elaborate on what it means by al-dhannu ghalib wa ghalabatul dhann. Well, that actually in essence means, if I was to put it down to percentages, then you would say that roughly you're talking about there's a 3/4 sort of chance that that person would actually end up in this situation. So you're looking around about above 70% chance that this person would become unwell if they were to fast, and that would be considered as predominant probability. So you're looking around about that sort of ratio. Okay. Regarding the issues you were referring to about health professionals who are upright, again, it's very difficult to know that. You sometimes just go by the outward appearance. You've got a Muslim doctor, a male, he's got a beard. You've got a female doctor who wears a hijab, and sometimes that's not, in essence, suggestive of somebody being very pious, other than the fact that they have the outward appearance. The reality is that because of the difficulty and the mushaqqa, the hardship, al-mushaqqatu tajlibu al-taysir, because of hardship, then ease arises, and on that basis, then any individual, any sort of health professional would be fine, as long as they are quite sympathetic to the cause of fasting. Now, you'll find some individuals who have, very low thresholds for saying, no, you're exempt, you should not be fasting. So we need to sort of avoid that. And this will be addressed later on by Dr. Nazeem in terms of how we've addressed this issue by some of the great work that's been happening through the British Islamic Medical Association, inshallah. Okay, right, now, this is a rubric, okay, of what we can use in relation to this, sort of bearing the time that we have. So these are sort of a four-principle approach to harm. So in other words, worsening physical condition, okay. The other is about slower recovery. So this is directly from the fiqh literature. This is not something I've just made up myself. So when there is slow recovery, okay. The other is there's a worsening mental condition, and there is worsening pain. So all these four sort of things or principles are things that you can use to then make a decision about this issue about approach to what we consider as harm. The question arises, at what sort of level do we say that the condition has worsened that we now can say that this person is exempt from fasting? At what level does that recovery have to be in terms of its slowing down, that we can actually now say that this person is exempt from fasting? At what level does that mental health condition have to be exacerbated for us to say, again, that now this person is exempt from fasting? And to what degree does the pain have to be sort of severe for us to make that decision? And the response to that is that it has to be such that it relates to the issue of what we call haja. And haja is a person is in need. So he's, in other words, he's harmed to that degree that he is unable to physically or mentally perform normal and important daily chores. So if it's just mundane things, like for example, I can't sort of go and do my regular jog that I do on a daily basis, that's not acceptable. It has to be clear physically or mental sort of symptoms that prevent you from doing your normal important daily chores. Okay, so this may be something as simple as, usually I cook, okay, I can't go and cook for myself, or I have a lot of I struggle a lot to even do something like that. I'm resorted to my bed to some degree. I can't really get out of bed. I'm quite unwell. So these are the kind, or even mentally, you're looking at somebody who clearly their understanding is probably not there. They can't relate to the rulings as much, or to that degree or clearly, or they're putting themselves at clear harm. Now, if you remember, I also talked about the issue about if there is what we call the tajriba. So if somebody has experience that if I fast, what will end up happening is I will become unwell. So this is the sort of the paradigm that you're using, that when you say that I will become unwell, meaning that you will end up in a state where predominantly you will end up either not being able to perform those physical duties or mentally as well as physically. Okay, inshallah. So hopefully that is clear. Clearly there are sort of gray areas within that, inshallah, but we'll hopefully discuss that in some of the panel discussions maybe. Now, I'm not going to go through this. This is something that will be discussed by the presentation by Dr. Nazeem. But generally speaking, you can see that these are kind of things that you may need to take into consideration as doctors or physicians. We recognize that if somebody's fasting, then you have a clear sort of approach to fasting. This is the general fasting blood levels for somebody who's not diabetic. But when they're diabetic, the blood sugars are going up and down throughout the day. So these are things you recognize there is a difference in somebody who's diabetic when they are fasting or not fasting. Then recognizing there are certain risks associated. For there's a risk of hyperglycemia, the blood sugar is going too low. There's risk of hyperglycemia, the blood sugar is actually going to becoming too high because they're not taking the medication during the right time. There's a risk or life-threatening risk of ketoacidosis, where their blood becomes quite acidic and acidotic, and as a result of that, they can end up becoming very unwell, and that can be life-threatening. There can be issue of dehydration. So they're actually passing a lot of urine because their blood sugars are very high and they end up becoming quite dehydrated. Thrombosis, so this is another risk of clots in the legs, which can go to the lungs, and that can be life-threatening as well. So these are the risks that we recognize, okay? We're also recognizing human behavior and the general compliance levels of individuals on their sort of behavior during month of Ramadan. All these things should really be taken into consideration when making decisions about exemptions. So on that basis, so these are sort of different sort of charts representing different sort of studies on Muslim behavior during Ramadan. So there are what we call general considerations. So what are the risks? So we recognize the risk of taking diabetes as an example. Can they be mitigated? How can we mitigate them? If we give them the right kind of advice, check your blood sugars through the day. That's the kind of right kind of advice. And if you find that they're going too low or going too high, this is the way you should deal with it. You know, can we check also to ensure? So these are sort of general considerations that we take on board in making decisions about harm considerations for diabetics, for example. Then we have what we call specific considerations. So we can say on the basis of general considerations, if the risks are clearly high, such as there's a chance of dehydration, ketoacidosis in these group of patients, then we can give a general ruling and say that these individuals should not be fasting, okay? And especially if they cannot be mitigated. Now, if there are specific considerations, on that basis, it's difficult to give general rulings, but rather what we do is we have to advise those individuals on a specific level. So there are risk of severe illness, etc. So you need to decide, are the risks severe for all, or are they just specific to this particular individual? And they may be specific for that particular individual because that person is not very compliant, because that person has other comorbidities, like for example, heart disease, asthma, and various bronchitis, which add to the problem. So you would deal with them on an individual basis. Recognizing also, is there enough family support in the house, and various other things. And on that basis, you would make that decision. So on that perspective, you'll see that general considerations are things that clearly medical bodies, so the work that's been done, for example, by BIMA, are things that we should take into consideration. Then there are specific considerations that individuals must approach either ulama and also physicians, their doctors, regarding whether they should be fasting or not. Okay. So this is a list of some of the conditions that this can extend to. So chronic diseases such as bronchitis, heart diseases. We'll talk a bit about heart diseases later on as well. Renal diseases, renal dialysis, all these kind of things are very, very important. Acute illnesses such as asthma exacerbations, and also in immunocompromised patients, especially during the month of Ramadan, who are considered as shielded patients today because of the fact that they are immunocompromised, more particularly in respect of the medication that they may be taking. So they're at risk of severe COVID symptoms. Okay, right. So let's just briefly talk a bit about principles of safe fasting for health professionals. Again, these are kind of things that you need to think about. So for example, what principles do you use to help decide whether the following patient should fast? So we have health professions or frontline COVID patient, dealing with COVID patients, and they're required to be in full PPE, so full sort of protection. You know, they've got masks, It's quite warm to be in those masks in that particular outfit. How, should they be exempt? Also, you have, for example, you may have doctors and health professionals who have their own illnesses. They may be diabetic. They may, when are they exempt from fasting? Then you may have health professionals who are in an environment which is quite challenging for them, especially during fasting. So they're operating in theatre all day, so the daytime, the evening. So, how should these health professionals deal with the issue of fasting? So going back to that rubric, as I mentioned before, if it's through experience, and clearly there is an understanding that my symptoms will be exacerbated, these are the things that you need to take into consideration in making those kind of decisions. But I'm going to elaborate on this a bit more. There are certain texts within the fiqh which elaborate on the issue of what we consider as mushaqqa or harj, fasting and hardship. So, for example, there are many texts which suggest if a person's work is hard and he'll be harmed by giving it up, and he's afraid of physical harm, then he may break the fast and make it up later on. So there's something about mitigating it as well, i.e. avoiding that work in the first place so that you can fast. So, clearly if if you can miss those or you take annual leave during that particular period, then ideally that's what you should be doing. And if you can't, then you should be mitigating as much as possible, reducing your surgical list, for example, being in an environment where you're taking more breaks, mitigating the circumstance. So with regard to those whose work involves physical effort and are in need of their earnings, such as bakers and harvesters, if he knows that if he works he will encounter harm and may make it permissible for him not to fast, then in that case it is haram for him to break the fast before he actually encounters hardship. And this is a very important point. So many of these circumstances, if you are not aware and you've not experienced the harm before, so you cannot have what we call tajriba or experience on this, then on that basis you should ideally be fasting, and during that time of fasting you note that you have exacerbated symptoms or you're facing a lot of hardship, then you have the concession to actually break your fast at that time. So it is not permissible for a worker to break the fast during the day of Ramadan just because he is working, but if he encounters great hardship that forces him to break the fast during the day, then he may break the fast with something that will ward off that hardship. The other thing is to understand here is that just because you have had to break your fast, that doesn't mean that you now partake in big meals and really go for it. The idea there is you should stick to the state of fasting suratan as much as possible. So in other words, you should still try to abstain from food later on, just take the sufficient amount to keep you going, and then also behave like you are fasting at least, and then do qada, make up for that particular fast another day. So, this is a quite important slide for those of us who are undergoing hardship. So just as a summary of that, when is a worker excused? When the weakness due to fasting must be a real cause, a risk leading to these. So either a physical or mental harm to self. Okay. The other thing is the medical legal reasons. Not just medical legal reasons, even though they are important. It's more so that having that conscious understanding that I'm not thinking straight and therefore I'm harming my patient. So there is the issue of risk of harm to patient as a result of the fact that I'm feeling quite dehydrated, etc. So that's something that you can take into consideration. And also significant risk of losing job or earnings, which was elaborated on earlier on. These are the things that you can take into consideration when making those decisions about fasting or not. So you need to start fasting ideally, and can only break fast when you feel weak. So if this is related to the physical, as well as the fact that you're reaching a stage where you're not able to think clearly. Also, your intention is essential. So if you're deliberately choosing to work during fasting hours so that you can be excused, then that is considered as karaha, that's disliked. You should not be doing that. And also the fact that you should make up for the fast later on. Now, clearly recognizing everybody is different, you find some individuals, they make these decisions subjectively on the basis of many different reasons. So the decision of the individual plays a role in this, so it can be quite subjective. How practicing you are, some individuals, they undergo a higher level of hardship, they've got high levels of threshold for hardship just to maintain their fast because fasting is important for them. And also medical opinion, going to different individuals and getting different types of medical opinions from different sort of expertise. People of different expertise, so that these things sort of play into this, and recognizing that you can have differences on the basis of this, and having an approach to this which is more uniform in relation to that individual is important. Okay, right. So having discussed that, I'm just going to quickly go over in the next sort of 15 minutes on invalidators of fasting. And I'm just going to talk about a couple of principles here, and I'm going to go through this at a reasonable pace, and inshallah, if there's time for me to talk about it in more detail in the panel discussion, I will do that. But these are kind of things that you might want to think about. Patient using an asthma inhaler, I'll talk a bit about that. Having a blood transfusion, maybe. A patient who's taking insulin, so if you inject yourself with insulin, does that break your fast? A woman using a vaginal pessary, sometimes this is quite confused, does that break your fast? An elderly gentleman using a urinary catheter, does that break your fast? So these are things that arise and they do crop up. And there are fiqh sort of texts that do relate to these particular areas, and they make suggestion that they do break your fast. So I'm going to elaborate on those points because we need to align it with our current medical understanding today, rather than the principles having been applied to the human anatomy and different understandings, in quite some earlier sort of formative period. Now, this sort of diagram is something that some of you are already quite familiar with, but there's a couple of things that you need to understand here. And the things that you need to understand here are, well, in essence, that the qualified agent. So in other words, the agent must be qualified. What that actually means is that it doesn't have to be something which is nutritious, or it doesn't have to be food and drink. It can be anything which is unedible as well. So even if you were to basically, chew on an end of a pencil, and some of the lead went through and you swallowed it, that would still break your fast. The fact that it passes your throat would break your fast. So on that basis, there's no distinction between what is edible and non-edible. Anything that sort of enters the mouth and then goes past the throat would actually break your fast. So the qualified agent. The other thing is about gases. So any kind of gas would, in essence, which has a clear discernible body, would actually break your fast if it goes past your throat. And also fumes that are not discernible, which is another very important point. There will be a document that I've produced. It's just going through sort of page setting at the moment. Inshallah, it should be out in the next day to 2 days, which goes into a lot of detail about these processes, mainly related to the throat, because that's one of the most complicated areas, because we eat and drink and it passes our throat. And for that reason, many of the more sort of complex issues arise about discussions about what passes the throat. So there's a quite intense paper that I've written on that. Inshallah, that should be out in the next few days. So there's something about the wasil. Al-wasil is the agent qualifying. So any of those things can qualify. Then there's something about the qualified cavity. So the al-jawf al-mu'tabar. So in essence, this relates to those cavities in our body which qualify as anything having reached there, then the fast will invalidate. So in other words, that's your throat, that's your general, in essence, it's your gastrointestinal tract. So it extends from the lower end of your pharynx all the way to your rectum. That area, anything that enters your gastrointestinal tract, is in essence something which invalidates the fast. So in other words, the qualified agent entering a qualified cavity through a qualified passage, al-manfaz al-mu'tabar. So a manfaz has to be something which is open, where a body can pass through, and it cannot be pores. So the pores of the skin, for example, or it can go through a process of absorption. Absorption is not considered as a process of reaching the cavity which is qualified. So in other words, it has to be a reasonable sized passage. There is a difference of opinion amongst the classical fuqaha related to even the lacrimal duct, which is the duct that goes from the eyes and extends into the nasal cavity, whether that actually is considered as a manfaz al-mu'tabar or not. And the difference is based on the idea that some consider it as so narrow that it would be equivalent to what we consider as a pore. For that reason, they would say that it doesn't invalidate the fast. So there are differences here which will be elaborated upon later. So anyway, qualified agent entering a qualified cavity through a passage which is qualified, i.e. a mouth, your mouth. Also the ears, if your eardrum is ruptured, then fluid can enter, or eardrops can enter your middle ear, and that can go into the throat. And if that passes the throat, then that will invalidate your fast. So, but majority of the time, even eardrops don't, eye drops don't, And also other passages may be basically the anal area, that's a munfazil mu'tabar, a passage that leads to the sort of rectal area and the colon or the big bowel. So that would be also something that would, so suppositories in essence that go quite deep in, they would in essence invalidate your fast. The other thing is about al-wasul. Al-wasul is the process of it actually passing. So in other words, if it disappears from view, the other example that is given, if some object is placed in the Hanafi fiqh literature, that if you were to place meat, it's a hypothetical situation, it's not reality, and place it on a string and you were to put it down somebody's throat, they were to bring it down into their stomach, and then you were to withdraw this, that the meat would remain intact and no remnants of it will remain in the stomach or the throat, that would not invalidate the fast. So according to the Hanafi, there has to have independent stay. So if somebody was to do a rectal examination, for example, and a clearly deep examination, that would not qualify as invalidating the fast in itself. The only reason that invalidates is because we put gel on, and as a result of the gel, that remains as a remnant there, and that will invalidate. So independent stay is important, and disappearing from view. These are two other issues related to process. Finally, what we have is the mawani' or the mani', the absolving state. So if somebody was to do this and they've forgotten that they fasted, so regardless of having eaten something, swallowed it into the stomach, they had forgotten that they were fasting, they would be exempt. So that's a certain exemption states, and I'll talk a bit about them in the next few slides. So here again, just to elaborate on those points, qualified cavity is the stomach, the throat, the intestine. So these are all considered as the qualified cavity or jawf al-mu'tabar. Then you have qualified apertures or manfas al-mu'tabar. So this is relating any orifice or opening of the surface of the body, be it natural. So even a peg tube, if you were to place a peg tube on which clearly goes into the stomach, that's an artificial passage that you produce. Even then it will invalidate the fast because that is a qualified passage going into a qualified cavity. The mouth, nose, ear canals, only if the tympanic or perforated eardrum. The same thing applies, which I elaborated on earlier on. So the duct of the eye, so the lacrimal duct, the pores of the skin, these things will not. So in other words, putting on sort of nicotine patches will not invalidate your fast. Using creams will not invalidate your fast. So these kind of things, sort of using your sort of understanding on that basis, and using these particular principles should give you some kind of indication of what does and what doesn't. So qualified agents, I talked about this before. It doesn't just have to be food or medication. It can be anything that's edible, non-edible. It can be liquid or solid. It can be soluble or insoluble. It can even be gases. So air, for example, air, because you've got natural elements of air, they will not invalidate your fast. So using oxygen will not invalidate your fast. However, if you were to use nitrous oxide, which we use for general anesthetic, that will invalidate your fast. That's not natural to air, even though it contains elements within that are natural to air, but the compound itself is not something that you find naturally in air. So sensations of hot, cold do not invalidate your fast. Feeling or tasting something at the back of the tongue does not invalidate your fast. It's the sensation that something's actually past the lower end of your throat that would actually invalidate the fast. Okay, and then we talked a bit about the qualified process already. And the states that absolve the qualified nature. So arduousness also absolves other than forgetfulness. So in other words, you're in a situation where the room is quite steamed up, and that's the environment that you choose not to be in, but you're just in there. Okay, and clearly you can't avoid the vapor in there. Then on that basis, as long as you're not forcing it down your lungs, then on that basis, that would not invalidate your fast. The examples in the books of fiqh suggest things, for example, that if you were walking and you were to catch a fly in your mouth and swallow it without intention, then that would not invalidate your fast. When you gargle, for example, when you use miswak, and also when you sort of inhale water up your nose because of the fact that you're doing wudu, ablution, that will not invalidate your fast unless you're intending it to go down your throat. However, there is an element of arduousness. You can't avoid small amounts of water passing your throat when you're doing that, so that is excused as well. Necessity, meaning that you're ill and that's why you need to eat. that will still invalidate your fast. That's not an absorbed state. Ignorance, oh, I've forgotten, I did not know this ruling, somebody just told you that that's broken your fast. Regardless of ignorance, it will still break your fast. If it's through an accident, so if you were to gargle and then you inhale water up your nostrils with quite some force, with no intention of it going past your throat, but it does happen that quite a lot has gone and past your throat, then that will still invalidate your fast. Coercion, meaning that if somebody was to hold you down or force food down you, that will still invalidate your fast. Sleep, unconsciousness, so if you were asleep and you were to consume something while you were sleeping, then that will still invalidate your fast. So these are absorbed states that I've sort of expanded upon. So very quickly, going back to this issue, these are the general states. Discernible body, ideally visible substance, but it doesn't have to be. For example, if you have incense or perfume and you're snorting this with force, okay, or you're snorting it into your body, and clearly you can feel it going past your throat, though sometimes it's not always easy to feel that, that would invalidate your fast as well. So there is karaha, there is dislike of you doing that kind of thing. The substance reaches the digestive system, the throat, stomach, or intestine. The substance enters from an entry point connected to the digestive system, the mouth, nose, or anus. The substance gains an independent state. You have no excuse, i.e. forgetfulness or arduousness. And then these 5 criteria must all be met for the fast to be invalidated. And that's the general gist of this. Okay. Now, this is a list of the common things that are relevant for us in the medical field. So you can already see that this sort of clearly identifies the things. There's a couple of red areas there, and I'll just talk about the red areas in the little time that I have, and I know there's quite a few questions. So the red areas are injections and fluids and IV fluids. Now, this is something that is quite confused, okay, and I need to elaborate on this. There's another paper that I'm going to be writing, inshallah, in the next week, which will elaborate on this point, that the fuqaha talk about the invalidation of fasting through 2 processes. One is suratan, one is ma'nan. Suratan meaning in terms of the act itself. So if it relates to eating and drinking, any kind of act that relates to eating and drinking will invalidate the fast. Okay, so that's the first point. So anything that passes the throat will invalidate the fast. Ma'nan meaning in terms of in its meaning. So the whole point of us eating and drinking is to gain sustenance and nutrition and strength. So the salahul badan concept, yeah, that is elaborated on. So in other words, on that basis, injecting fluids and things like that would actually invalidate the fast. Now, if you were to inject, when I say injecting fluids, I'm talking about specifically intravenous, which are going straight into the venous system or the circulatory system, those will invalidate the fast. But if they're going through entry points like the skin, subcutaneous tissue, sublingual, where they're absorbed in the mouth, and absorption, which is outside the sort of qualified cavity, those kind of processes will not invalidate the fast, regardless of them being nutritious. But rather it has to be something that enters the circulation directly. So other states may be, for example, hemodialysis as well, that will also invalidate the fast in this sense. So already you can see acupuncture will not, creams, lotions, and deodorants will not, gastrostomy, peg tubes will not, will, because clearly they enter the stomach, the invalidating cavity. Okay, gastrostomies clearly are clear. Injections of fluids which are going via intramuscularly, subcutaneously, they will not. Okay, let me start again. If they're going into the venous system, like I explained before, then they will. But if they're going through just soft tissue and sort of the skin and so forth, then they won't. Patches again won't. Inhalers and nebulizers, this is an issue of contention. And to be honest, in reality is, the main principle here is that if you are intending for something to pass your throat, to get into your lungs, then regardless of that, the intention is that you're intending to pass something through your throat, then that will invalidate your fast. Now, some of that does enter your stomach as well. So there's a lot of evidence to suggest that it does. Now, the argument against that is that it's a very minute amount and it's unavoidable. And for that reason, because of unavoidability, the arduousness, that it should be excused. The reality is that's incorrect. Because the reality of this is is that if you're intending for it to pass your throat in the first place to achieve it going into the lungs, and it's having to go through that process, then it will invalidate. If you are intending to go to room B, but you have to go through room A to get to room B, then clearly as part of your intention is that I will have to go through room A to get to B, i.e. I have to go through the throat to get to the lungs, then you are passing this past your throat to get to your lungs, and for that reason, it will invalidate the fast. So inhalers and nebulizers do. Endoscopies, yes, they do, but only because of the fact that you have, you're using maybe throat sprays or you're using gel, which are passing the throat. Lighting incense, it doesn't, but if you intentionally do this and you're inhaling it and it's going past your throat, then that will be a problem. It will invalidate. So there's a dislike for these things. Nose sprays, nasal drops, they don't generally, but if you clearly feel them passing your throat, then they will. Not just tasting them at the back of your throat, but they have to pass your throat. Smelling food, perfume, they don't. But again, if it's clear, intense fume and it's passing your throat, then they will. Smoking clearly does, because it passes your throat and enters your lungs. Some of it enters your stomach, so clearly that would be, to some degree, equivalent to using inhalers and nebulizers. Toothpaste, mouthwash, again, they won't unless they pass your throat. Ear drops won't. I talked about that earlier on. So the classic literature recognized the human anatomy in such a way that the nasal cavity and the eye cavity, anything sort of in the upper half of the face, was actually directly connected to the brain. And the brain is an area which provides nourishment. So for that reason, and it's connected directly with your sort of gastrointestinal tract. So that was the understanding of the anatomy where Muslim scholars applied the fiqh there. So now we know that that's not correct. So we use their same principles and we apply it to the anatomy that we understand today. And that recognizes that anything that enters the brain does not invalidate your fast. Similarly, there was an understanding that amongst some of the fuqaha, that the bladder was connected to the gastrointestinal tract. Also, that the upper part of the vagina was also had a passage to the gastrointestinal tract. And for that reason, they would say that anything entered those two cavities would therefore invalidate the fast. We now know that that doesn't. So for that reason, any of those using a catheter, using vaginal pessaries will not invalidate the fast. Okay, they might break your wudu, invalidate your wudu, but they don't break your fast. Okay, that's the important thing to understand. Okay, so where are we? Okay, eye drops, ear drops, sublingual medication clearly just dissolves in your mouth, so it doesn't pass your throat. Anal suppositories, again, if they go high enough, rectum, they can. Vaginal urethral examinations don't. Urethral catheter cystoscopies don't. Extracting blood or cupping doesn't. Okay, and then finally, nutritional IV fluids, which I talked about earlier on, and dialysis, they will. Okay, because they are giving salah al-badan, and for that reason, they will invalidate their fast. Okay, right. So I know I have maybe 1 minute, but inshallah, if there's any particular questions that anybody want to ask, they can probably ask in the panel discussion, inshallah. Other than that, if there's one question, Dr. Rashid?
There are plenty, and
plenty, I'm sure.
some of them have been addressed definitely. I think it was as expected regarding routes of administration, as you elaborated. Some of them are tricky, especially when the route is not is a valid, not a valid route, but it's giving nutrition. So a lot of questions about that. You've already addressed those.
Okay.
There have been questions about more the principles. So I think you can leave it for panel discussion. It's up to you, Dr. Sheikh Rafaqat.
Okay.
The question is a very, very interesting question. Basically, what it says, I'll try and read out. What it says here, the question it says here is that who is the person who decides the qualifying agent, passage, and cavity? Should it be the scholars who know more about the human physiology and anatomy and how the medicines work, or should it be vice versa? Should it be the healthcare professionals having some basic knowledge, the knowledge that you've shared with us today, making those decisions? You can leave it for panel discussion if you want to, or if you want to address it now.
I'll quickly answer it because there's a quick answer to that. I mentioned it earlier on, and I will elaborate it in the panel discussion as well. The scholars provide principles, okay? So they provide principles, and these principles are taken directly from the verses of the Quran, okay? So in other words, the concept of what we say, imsakul akl wa sharb, yeah, ma'nan wa suratan. So in other words, what you're doing is you're refraining from the act of eating or drinking in terms of its the form and its meaning. So what that actually, so they elaborate on those 2 points. Form meaning that the act itself. So anything that relates to the act of eating and drinking will actually break the fast. So it doesn't even matter if it's edible or inedible, if you're actually swallowing something which isn't even edible. So they elaborate on that. They provide the principles. Then say ma'na, meaning that it's giving some kind of rejuvenation to the body or giving some kind of strength to the body. But they limit that to a number of different things, and they use the hadith and the prophetic tradition to do that. So they provide the principles, and then they need to engage with clear, the people from the sort of medical field to devise how those principles should be, in essence, applied. Okay, so that's how the engagement process goes on. So inshallah, this document that should be going out in the next day or two does that, and it relates mainly to the throat. So inshallah, I'll finish on that note. Jazakallah khair.
Jazakallah khairan. Wa alaikum assalam wa rahmatullahi wa barakatuh. We'll have you back again, inshallah, for the panel discussion.